Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz, joining you once again for another set of pointers for your next generation NCLEX RN test preparation. Okay, so this is actually our set number 24 or pointers number 24. So before we get to start, let me congratulate our newly crowned NGN passers. You have Renny Rose Laban, USRN, Brian Delang, USRN, and Paula Dian, USRN. And if you would take a notice, they are one among the thousands of passers that we have produced. Now, on your rightmost portion, you get to see a picture of the classes I've conducted in the past, and that's the sheer volume of those who are engaging in the teaching and learning session of the Ray Gapuz system. Thank you for your trust. And of course, let's begin with an inspiration this time around from Ana Gisela Ribogio, the 2-in from St. Louis University, who passed the New York Board of Nursing NGN last September 6, 2023. And this is what she has to say. Enrolling in the Ray A. Gapuz review system is one of the best decisions I made in pursuing my American dream. The program is a complete package. I utilize all the resources they offer, and it was my key to success. Thank you very much for the very kind words. I put my trust in the Lord, put in a lot of hard work. You need that, dedication to my study habits. The comprehensive review was the foundation or the backbone to my nursing concepts. I put to heart the functional concepts perfected by Sir Ray, very unique to the Ray Gapuz system. I attended the 10 days intensive boot camp that's being done at the summer capital of the country in Baguio City. It's actually a 10-day live-in boot camp review held in Baguio City, where the most important concepts are discussed and are very useful in the NCLEX exam. I joined the 3 days quick fix face-to-face that served as my final coaching. It was vital because I was trained to focus on what is important and to answer hundreds of questions in their Cuba. I was given access to the course shell. It sealed all the information I absorbed from day one, starting my review. It took me 3 months in total to dedicate my time and review for the much awaited day of my exam. When I took the NCLEX exam last September 6, 2023, I came in prepared. I was ready for the battle I will face. I will never forget that day because it pushed me to my limits. The stress and pressure came on that day. I was one of the last test takers to leave the testing center. All my dreaded next generation questions attacked me. I stopped, I closed my eyes and took a deep breath. I went on to answer each question with confidence. When the time was up, I raised my hand and ended the exam. After 3 days, as I checked my quick results, I passed the NCLEX exam. I am so grateful to Sir Ray for introducing his system to us nursing students. I graduated last 2010 and I passed the NCLEX in just one take through his strategies. I also want to extend my thanks and gratitude to my family and friends who supported me all the way in this journey. To the aspiring nurses out there, if I can do it, you can also. You're next. I am Ana Giselle Roborgio, the 2-in USRN. Congratulations, Ana, and our hats off to your discipline. Okay, so join these passers. There's actually hundreds of thousands of them in more than 30 countries where our system is now present. Now, let's begin this NGN pointers number 24 with the question, what are the things that you need to study? Of course, you need an expert's opinion to tell you what to study. And for me, these are the things that I'd like to highlight for you. First, let's talk about the second stage of labor. And remember, our method, it's always with the use of the functional concept. Now, a functional concept could be a word, a phrase, a sentence, or even an entire paragraph that gives you a direction to how you should deconstruct a question on the test. So, for this specific concept, we begin with this functional concept. In the second stage of labor, or the pushing stage, interventions include, now remember, fetus. Why fetus? Well, that's the acronym for the set of interventions because the second stage begins from the full dilatation of the cervix up to the delivery of the fetus or the baby. Okay, so F means fetal heart monitoring should be done every 5 to 15 minutes, and that should be done continuously. Then essential newborn care, which involves drying the baby, delayed cord clamping to make sure that the cord pulsation have stopped, and definitely that would help prevent anemia in the newborn. And the most important part of establishing bonding is skin to skin contact between the baby and the mother, not the mother and the father. Okay. And then talk and instruct the mother regularly. So it's always important for the mother to be updated of the goings on of how the efforts are resulting to the desired outcome of the delivery process. And then put the patient in an upright position that would enable them to have effective pushing and support the bearing down of the mother so they can push effectively. Once again, the acronym FETUS. Now, here's a 60-year-old lady's story. Sorry to interrupt our discussion before we proceed. Let me just share with you this very good news. Hello, Dr. Ray. This is from Jane Resurrection. Okay, magandang buhay. That means good life in English. I took my test last September 12, 2 days after my 60th birthday. Yes, senior citizen and proud to be a USRN. My secret to success is lots of prayers. This is the truth. I spent more time praying than studying, and it is because of my age handicap. I really notice I am having memory problems at this tender age. I'm thankful that I have good nursing education foundation from the Philippines years ago, and it helps me to this day. It was hard to retain new information. My computer stopped at 104 after 3.5 hours. I was stunned. I remember pacing myself very slowly. When the computer did not stop at 85, I wanted to reach 150 questions. I couldn't even remember the last question. I remember praying in my head and said to myself, I need a miracle. God, please help me. I went to Mass daily. I prayed hard before sleeping and when I wake up. And that was my cycle for the past 11 days of waiting. My anxiety was rising by the day. On the 12th day, God surprised me with this miracle. I passed. I'm having goosebumps. Okay, thank you, Jesus. All glory to you, Jesus. So, this is what she has to say. Now I am a USRN at 60. Life begins anew for me. I will use my remaining life in the service of self-healthcare delivery. To you, Dr. Ray, I give you my heartfelt thanks. And I salute you for your lifelong commitment to improve the lives of not only Filipino nurses, but nurses from all around the world who believe in the Gapuz system. I see how you tirelessly keep going in producing Gapuz NCLEX passers, critical thinkers ready to embark on the new generation patient care. Big hugs and see you soon. That's Jane Cheneo Serrano, now a USRN, from the Philippine Women's University, who passed the NGN from the State Board of New York last September 12, 2023. Okay, now let's move on to my second important concept that I'd like to highlight, and that's going to be your status asthmaticus. Now, remember that this is a medical emergency. Let's begin with a functional concept. Status asthmaticus is an extreme asthma that is considered a medical emergency. Now, when you say extreme asthma, this is the time in which albuterol may not work, your subcutaneous epinephrine may not work, and so it's very important to bring the client to the hospital. Now, if a patient's taking albuterol, remember that the drug could potentially cause palpitations, so it's important that you check the heart rate. So, what are the manifestations that the patient's having status asthmaticus? So remember SOB, and that means shortness of breath, oxygen in the blood that is decreased or hypoxemia, and of course, bluish lips. So what needs to be done? Now, we have to ensure that the patient is brought to a medical facility because the potential complications could be your hypoxemia, and initially, there could be respiratory alkalosis because of the tendency of the patient to hyperventilate as they try to catch their breath. And then eventually, they retain carbon dioxide, so they may have hypercarbia. Now, what is important to note is that when we bring the patient to the hospital, the treatment regimen may involve the administration of your terbutaline, steroids, as well as magnesium sulfate. Now, this combination of treatment would help relax the muscles of the airway and therefore will help facilitate breathing. So pay particular attention to that important aspect of status asthmaticus. Okay, so let's move on. The third tip that I'd like to highlight would be the fire response protocol. Let's begin with a functional concept. Fire response procedure involves, remember, the acronym RACE, which means rescue anyone if it does not endanger you. Second, alarm activation, and then confine the fire by closing the doors and windows, making sure that you are already out of the room. You don't close the doors and the windows and you are inside the room that's on fire. And of course, extinguish the fire or evacuate the area. So it's your choice. So either extinguish it or to evacuate it. Once again, RACE, rescue, alarm, confine, and extinguish. Okay, so these are the functional concepts that I'd like to highlight for this session. And we also all have a feedback here from those who availed of our services of our international test applications processing services. We do help you process for your NCLEX, DHA, whatever test you're taking. If you have difficulty processing your papers, please come to us. Okay, this is coming from a client who made use of our services. And in a nutshell, it says here, naging maayos at hassle-free ang application ko sa pagiging USRN. I started my application on March 2023, and then she thought it would take her 4 to 6 months, but usually with our system of allowing you to choose which state board you want to apply and then providing you with guidance, we can do that in 1 to 2 months. Okay, so those of you who may want to avail of these services, give us a ring. Anyway, and the next important thing that you need to focus on when you are preparing for the NCLEX RN is to learn how to study with technology. And when you say you study with technology, let's take a look at how some of our students are appreciating what we have in our system. So Jane says, oo, systematic siya, sir. First day ko pa lang, alam ko na papasa ko. March 10. Follow ko lang yung sked, tapos after lecture, sir, babasahin ko siya ulit. Ganun lang. Hindi na nga ako nag-exam ng kung ano-ano. TOP lang ninyo at mga pretest ng mga mentors, sir. TOP is part of our system. It's different from our core shell. It's also different from our learning tools that includes the 3 books, nursing reminder sheets, quick fix in pharmacology, and the favorite of NCLEX RN passers, NCLEX 311. These 3 important books would enable you to pass your test on your first try. So remember, NCLEX 311 is the local version of the book that I've written for Jones and Bartlett USA, which when it launched was in the top 20. It was number 12 on the Reader's Choice that time. So I asked our passers, what book helped you the most, ABC or 311? And then one of our pastors said, 311, sir, lalo na yung mga key points doon. Now, NCLEX 311 is the local print of NCLEX RN Flash. This is available in Amazon. For those who are not in the Philippines and in the US, you can buy my book from Amazon. And this is how it looks. Of course, for the international edition, you have a colored page. For the local edition, you have it in black and white. But the local edition, you get it for free if you are in my class. Okay? So you have here the functional concept, and then, of course, the pointers, sample question, the answer, and the rationale. Plus, you have references. Okay? So these are all part of our learning tools, including the first Filipino-authored nursing review book published by Mosby Elsevier that won in the International Book Awards. Okay, so this is now how our course shell looks like. And the third and most important in your preparation is you have to be in a conducive environment that should help you keep your focus. Here at the Gapuz system, we have our own next generation NCLEX simulation room, and we have classes that are very, very comfortable inside. So if you want to experience our test preparation system, please join us in our NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee starts at $3,499, where you can use our Q Bank plus the 3 books, Next Generation NCLEX Strategies, and my 3-day quick fix session. So it's your choice if you want to do it here at the Gapuz building live face-to-face, so doing that on the 4th floor, and then live virtual class, or you may want to have unlimited on-demand video recordings. It's your choice. We welcome you with any choice you make. So once again, this is your mentor, your fact check buddy, saying, I'll see you in the next video. And thank you very much for your continued trust.